Okay, sorry for the delay. We're trying to gather the information the governor had just released, so we'll get into that. Good afternoon. I'm Cookeville Mayor Ricky Shelton.
And I'm Putnam County Mayor Randy Porter. This is our COVID-19 coronavirus community update. As of today, our total number of confirmed positives in Putnam County is 24, which is 7 more than yesterday. As you can see on the state map behind us, the number for the state of Tennessee is 1,834. This map is only updated once daily at 2 p.m. Any cases added after 2 p.m. will not be included until the next day. The other counties in the Upper Cumberland that have confirmed positives are Cannon with 2, Cumberland has 11, DeKalb has 4, Fentress has 1, Macon has 3, Overton has 2, Smith has 1, and Warren County has 1, along with White County has 1. Again, Putnam County has 24 confirmed cases, which is 7 more than yesterday, and I'm going to repeat the Upper Cumberland counties for you also. Cannon County has 2, Cumberland County has 11, DeKalb County has 4, Fentress County has 1, Macon County has 3, Overton County has 2, Smith County has 1, Warren County has 1, and White County has 1. Again, Putnam County has 24 confirmed cases, which is 7 more than yesterday. Just remember, we can only report the actual confirmed cases that have been verified by the state health department. With our testing, if you have symptoms and want to be assessed, you can call your primary care physician, or the Putnam County Health Department is doing drive-through assessment and testing weekdays from 9 a.m. to 3 p.m. The health department is located at 701 County Services Drive. The National Guard is on hand to help with the testing, and we are very appreciative for these fine men and women being with us. Mayor Shelton.
So this is in our community, and we must stop the spread. You could have it now and be a carrier with 0 symptoms. When you go home, you need to wash your hands and wipe down anything you touched. I listen to the experts, especially the ones here in Cookeville, who care about us and are on the front lines. We've been advised to stand 6 feet apart from others to lower our risk of getting infected with the coronavirus. We've told you that, and I'm standing here because I care for you and our community. Both of us do. And we implore you to listen and to follow the directives given by those on the front lines. The Centers for Disease Control and Prevention describes physical distancing as remaining out of congregate settings, avoiding mass gatherings, and maintaining distance, approximately 6 feet from others when possible. The reason is when someone coughs or sneezes, small drops of liquid can spray, and then you can end up catching it from those droplets. So, if the main thing to do, as we've talked about, is the 6 feet of distance rule, which is the width of a bed, the width of a vehicle, the length of a couch, those kind of things to get that in your mind. But we all must take personal responsibility to heed the guidance from these experts and to do our part to help stop the spread. You must use common sense so that you can be part of the solution.
Everything's been changing as we've been in the last hour with the governor's new order. So at 3 p.m. today, Governor Lee issued a safer at home order for the entire state of Tennessee. We've been going through the details, Mayor, and so we're going to say that we're going to hit the highlights as much as we possibly can of this order, but we do not have all the details and have not had enough time to digest it yet. We suggest that you take time to digest it and look through the orders. It's available on a lot of the websites, especially tn.gov. This order was issued this afternoon by the governor at 3 p.m. and the order says it's directing Tennesseans to stay home unless engaging in essential activities to limit their exposure and spread of COVID-19. Now, the governor did issue a list of non-essential businesses, Mayor, that he is closing, and I think you have that list.
I do, and to Mayor Porter's point, what many of the cities in the state that already had something had a safer at home, and so this pretty much makes that across the state of Tennessee now. The Executive Order 21, which was issued on March 22nd, which was the original one that talked about no groups of 10 or more and the gyms being closed and things like that, was modified today, was amended to include these two categories: that will now be closed. Businesses or organizations that perform close contact personal services such shall not be open to members of the public. Such businesses or organizations include, but are not limited to, barbershops, hair salons, waxing salons, threading salons, nail salons or spas, spas providing body treatments, body art facilities or tattoo services, tanning salons, or massage therapy establishments or massage services. Again, these are orders issued by the governor. Also, entertainment and recreational gathering venues shall not be open to members or the public. These venues will include, but not limited to, nightclubs, bowling alleys, arcades, concert venues, theaters, auditoriums, performing arts centers, or similar facilities, racetracks, indoor children's play areas, adult entertainment venues, amusement parks, or roller or ice skating rinks.
Mayor Shelton, there's also a whole list of what's considered essential services, and there's one more section of the non-essential businesses for public use, and I'm going to highlight that with what it says. It says businesses or organizations that do not perform essential services shall not be open for access or use by the public or its members. Such businesses or organizations are strongly encouraged to provide delivery, including delivery service, curbside service, outside the business or organization, or online or telephone orders to the greatest extent practicable, and persons are encouraged to use any such options to support such businesses during this emergency. Now, there's a whole list of essential businesses that I'll run through, but there's no way for me to list every one of them, so I'm just going to hit the highlights. And as we will be having, Mayor Shelton and I'll be having a conference call with the governor in the morning, I think at about 11, and we'll get more details. And as we get more details on this order, we'll be posting that for you. But also, remember, we're reading from what the governor has just put out just a few minutes ago, and we're trying to hit the highlights for you, but we can't answer all the questions.
We understand it's confusing. It's confusing to us because literally we just printed this off, and so we're trying to be as transparent as possible with you, but we don't have all the answers. But please go to tn.gov. These will be listed there, and then you can read through them yourself to see how it affects your business or your employer that you have.
And when you look through the governor's order, he talks about, even though some of these things are essential services, and there's a whole list of those, that you should still be limited to coming in contact with those businesses unless you absolutely have to. He's also asking that all those people use the CDC guidelines, those businesses, for them being open, as far as making sure that they keep the 6 foot social contact and make sure everything is cleaned and sanitized and so forth. There's also a mandate in this that employers shall not require or allow employees with the COVID-19 who have tested positive for the CDC guidelines or should not be allowed to work. That's part of it. Essential activities are things that are essential to a person's health or the safety or the health of their family members. Obtaining services such as food and groceries and medical supplies and automobile supplies, all those kind of things are still allowed. Takeout and curbside delivery of food is also still allowed. Making sure if you engage in any kind of outdoor activity, you make sure you go by the CDC guidelines and making sure that you keep the social distancing. You're still allowed to care for a family member, pet in another household, or traveling to go to those people to make sure they're taken care of. Essential travel is listed as travel that you're performing for any essential services, travel to care for any elderly, minors, dependents, or persons with disabilities, travel to or from educational institutions for picking up materials for distance learning or for receiving meals, traveling to outside from the state of Tennessee, law enforcement, courts, all those kind of things. Critical infrastructure will remain open. So there's a whole list. And
Mayor, I think the crux of all this that you and I have talked about this. This is to implore you again to stay at home whenever possible. Much of this, as you can, you just heard him read that. There's a lot of confusing things, but the bottom line is this: if you don't need to leave, don't. If you if you need to go pick supplies or groceries up, don't take 6 people from your household. One of you go. That's limits.
Or don't go every day.
Don't go every day. Go once a week. Get enough for what you need that week. Limit as much as possible your exposure to others. Physical distancing. That's what we can continue to tell you. You can't legislate and mandate all of these things. It's unenforceable and it's very difficult. So what we're asking, again, for the many, many times, is trying to get you to understand and explain to you that we all need to do this and be a part of the solution. And that means doing your part to limit that exposure, to limit the physical closeness to other people so that we can get past this and people can quit infecting other people. That's the bottom line.
Right. And our recommendation is if you would just act like everyone you come in contact with has the virus, then we would be able to help stop the spread of it.
Don't shake hands.
Yeah, don't be hugging, don't be shaking hands. Keep the 6-foot distances. Don't be going places that you don't have to. And you think, well, how can I do that? Well, every person that you meet, keep your 6-foot distance. Act like they had the virus, just like you would if somebody had the flu or something else. Keep your distance and try to wash your hands and go through all the hygiene that you possibly can. And I know you keep hearing us saying this over and over, but that's the way that we stop the transmission of this disease. And absolutely, we recommend, and we have recommended for the last 10 or 11 days, for people to stay at home unless you absolutely have to go out. We don't want you to panic during this, but we just want you to use common sense. And if everyone would do that, we'd be able to stop this spread. We're asking everybody to stay off public playgrounds and avoid public facilities such as bathrooms and park benches. Do the social distancing, keep 6 feet apart. Just remember that even though you don't have the symptoms of this virus, you could still be a carrier of it and not even know it. So try to keep the social distancing up as much as possible. Avoid all gatherings. Even if they're gatherings of your family members who you don't live with, don't go to your parents' or grandparents' house unless you absolutely have to take care of them, because you never know when you're a carrier of the virus and may be spreading it. Wipe down all your frequently touched surfaces, phone, doorknobs, countertops, steering wheels on your vehicle, especially after you've been out somewhere or been shopping or to one of the stores. If a family member gets sick, try to isolate that person as much as possible to keep other family members safe. And as Mayor Shelton said earlier, don't make daily trips to the store. Get what you need to last you a few days. And each time you venture out, remember your risk increases for you getting this virus. Please don't hesitate to ask the business also, and we had a lot of questions about this, takeout. So you've got grocery stores that offer takeout services where you can do your order online and then go to the grocery store and pick it up. They'll even bring it out to your car for you. Food is the same way. So use these services. There are also a lot of delivery services that we have available in Putnam County where they will actually go and pick the food or groceries up for you and deliver it. So we'd ask that you use those as much as possible. We're not trying to scare you. We're not wanting you to panic. We're wanting you to remain calm, as we have asked you to do from day one. But we want to make sure that everyone takes this seriously, because the only way we're going to stop our numbers from continuing to go up on a day-to-day basis is for us to use these precautions and act with common sense and make sure that we take care of our fellow citizens.
That's right. So I'll give you the update on the city and our regional medical center. So all public services in Cookeville continue. That includes fire protection, police protection, utilities. City Hall and other city buildings are closed to the public until further notice. Cookeville Performing Arts Center, that includes the Performing Arts Center, obviously, now including Parkview Skate Park, Cane Creek Rec Center, museums. Cane Creek Park and Dogwood Park remain open, except Heart of the City Playground. Again, use your physical distancing when you're there. Cookeville Regional Medical Center. The medical center currently has a total of 3 patients admitted to the hospital. They continue to monitor their situation with medical staff and employees. CRMC is taking all steps necessary to conserve protective gear at this time. They continue to follow proper precautions in protecting patients and staff by providing all necessary protective gear according to CDC guidelines. With that said, some staff are wanting to use protective gear above and beyond precautionary guidelines. To help reassure them, they are allowing staff to wear medical-grade hospital-approved masks that have been purchased in both clinical and non-clinical areas when not performing direct patient care. Like all other hospitals across our country, CRMC has a limited supply of protective gear. They have a responsibility to conserve this supply so that they may have the supplies needed throughout the course of the COVID outbreak to properly protect patients and staff. They want to reassure the citizens that the medical center is doing everything they can to properly care for patients during this time. Now, at this time, we have an update from Tennessee Tech, and here's President Phil Oldham.
Thank you, Mayor Shelton and Mayor Porter. It's always good to be with you guys. And as I've said before, kudos to both of you for keeping this whole community informed and updated. And you guys are doing a great job. We all appreciate it greatly. Just a couple quick themes on behalf of Tennessee Tech University. This clearly is unprecedented emotional and operational challenges for us. Tennessee Tech is one of the essential services as listed by Governor Lee, and so we intend to maintain those essential services to our students, albeit in a very different methodology. And thanks to an incredibly caring and amazing response from our faculty and staff on campus, those needs of students are continuing to be met. As of today, Tennessee Tech has no confirmed reports of any campus community member testing positive for COVID-19, and we're certainly very happy with that, but we're also very aware that it is likely that at some point in time we will have a positive test to a campus community member, and we're prepared for that. So we are taking the risk very seriously. I'll run through a list of the following changes that have been implemented to ensure the ongoing health and safety of the entire university community. As we continue to deliver classes for students in an online format, students and faculty will complete this spring semester through online instruction, and that began today. So we extended spring break for an extra week this past week. So students have been away from campus for really over 2 weeks now. Most of them are still away from campus. The total campus community has been reduced to a small fraction of what it normally would be at this time of year. Those students are continuing, however, in their normal spring coursework through online instruction, and we really greatly appreciate the work of the faculty to make that possible. So we will support students to complete the spring semester and receive a final grade. We're looking at a lot of options right now to accommodate students in their particular situations to relieve any anxiety that's accompanying that in terms of completing the semester. So we'll have some more announcements to come out later this week, I would anticipate in that regard. But we will help each student finish the semester, and those that are scheduled to graduate will complete those requirements on schedule. As we have announced, we're not canceling graduation commencement services, but we are postponing those to a later date yet to be determined. We really need to get a few more weeks down the line here to see when that's going to be safe and appropriate to do, but we'll look forward to that at the appropriate time. The campus is continuing to operate. We're down basically to essential personnel only on campus. Everybody else is working remotely. Offices are being staffed for the most part, but very much at minimal levels. Our goal is to reduce the personnel on campus to between 10 and 15% of normal workforce, and we're getting pretty close to that at this point in time. All meetings requiring 10 or more people, and actually almost all meetings on campus now are taking place through virtual means on Zoom or other mechanisms. Residential life housing is, with the exception of Tech Village, is now closed. We've granted a few waivers to students to remain in housing where they had really no other options on where to live for the next couple of months. But that number is down to approximately 40 students, from about 2,300 or so that it would normally be. So it's significantly reduced. And as I announced last week, the university bookstore is available, but it's in an online format only. So a lot going on there. Dining services will is continuing to serve students on campus, but limiting to Chick-fil-A and the cafeteria with takeout options. Volpe Library is operating from 8 in the morning to 7 at evening for students who particularly need assistance with their online courses. Circulation of the library is closed. So most of the functions of the library are closed. It's really simply serving to support those online students. Fitness Center and Athletic Performance Center and Craft Center Gallery are all closed. Counseling services are available 24/7, but that's being done in a telecounseling type format. So we continue to look to the future. However, we got to look for ways to, as we come out of this, how do we recover? We're continuing to contact students through calls, emails, social media, and everything else to stay connected to them. We continue to recruit and reach out to prospective students and their families through virtual tours, emails, and calls. And we continue to remember that our students at Tennessee Tech really are unlike most other college students. They didn't have time to catch their breath after the tornado and deal with the aftermath before this challenge hit. Still, they're showing tremendous signs of resilience and will continue as all of us at Tennessee Tech to live wings up. It's great to be part of this Cookeville and Putnam County community. We're very fortunate to have great leaders here in our mayors and so many wonderful people in this community, first responders and others that help keep us all safe. So great thanks to everybody involved, and thank mayors for letting me join in today.
Thank you, Dr. Oldham. Appreciate you being here and appreciate what Tennessee Tech means to us as a community. Just a little more update on the essential services. So I asked you to go and look at this, the governor's order we just got right before we came on the air. There's a big list of about 30 different essential services and a lot of categories under that. A few of them are healthcare and public health operations, so don't worry, your healthcare, doctor's offices, hospital, all nursing homes, all that's going to remain open. Daycare centers under human services operations are remaining open.
Hey, we need to remind them too, though, about the visitation at nursing facilities.
Yeah,
that's just like the hospital. There's no visitation allowed. I know some have called and with concerns about trying to get in. It's not allowed. As you can see what happened in an adjoining or a county close to us.
Right.
Very bad. It spreads through there, so they're trying to limit that. So no visitation in any of the nursing facilities.
Right. Essential infrastructure, roads, highways, bridges, all that kind of thing. Essential government functions, of course, all of our emergency services and everything will continue to operate in all our essential government functions. Food and medicine stores, food and beverage production, agriculture, organizations that provide charitable and social services such as our rescue mission and those kind of places are remaining open. The media, gas station, businesses needed for transportations, all our financial institutions and insurance entities, hardware and supply stores, critical trades like building and construction, the mail, post office delivery and pickup services, laundry services, restaurants for pickup and takeout, supplies to work from home, transportation, home-based care and services, residential facilities. The list goes on, hotels and motels, funeral services and those kind of things. There is multiple pages of this that we have not had time to digest yet, so I suggest that you give us a little time to be able to do that. If you want to check it out ahead of time, go to the state's website at tn.gov. Mayor Shelton and I will be talking to the governor in the morning, and hopefully we'll be able to get more details and have you some more stuff either tonight or later tomorrow. Remember, we created a map for our Putnam County businesses and restaurants with the business hours and details on those. PutnamCountyTN.gov or our mayor's Facebook pages. You can look at that map. If you have a business or a restaurant or something you'd like to be linked on the website, on the map, you can go to our website, and there's a link also for you to be added. Our county office closures remain the same. All of our county employees, essential employees, are still working. Courthouse and most of our county facilities are closed. We have several drive-throughs, drop-off boxes, and so forth. So you can go to our PutnamCountyTN.gov website for a list of all of those closures. Also, our sports facilities, community centers, and library still remain closed.
So to wrap this up, When possible, stay at home. Everyone must do their part to stop the spread. Now's the time to help by taking this serious and being part of the solution. It affects all ages. We must be diligent to physically distance. We know it makes a difference to protect the health and safety of your family. Again, we implore our citizens and local businesses to minimize personal interaction. Even if you're not on a list of closures, please do that. Plain and simple. Stay at home as much as possible. Don't panic. Support one another. Wash your hands. Take this serious and do your part to limit the spread. Make reasonable, educated, common sense decisions. We will get through this, but we must make sacrifices now to come through this in the long term. For the most up-to-date COVID-19 information, links, and resources, you can visit bettercookeville.com and click on the COVID link there, and it has links to all the national, state, and local information. So continue to pray for our county, our healthcare workers, and our responders. Let's choose faith over fear. Stay at home when possible. God bless.
Absolutely. As I continue to say, we live in an awesome community where we care for one another. We're Putnam County strong, and we will get through this if we will remain calm and work together and listen to all this advice. You shouldn't need a piece of paper to tell you that you should stay at home or wash your hands or do all these kind of things that we should all be doing to help protect the citizens, our friends, and our family of our great county. So please continue to keep us in your prayers. Mayor Shelton and I will continue to do live updates to keep you informed. We possibly will do a live update tomorrow. We don't know. It could be Wednesday, depending on how much information we get tomorrow. At least we'll be doing a Facebook post tomorrow to be able to get you as much information as possible. So please continue to keep us as your community leaders in your prayers, because it's a tough job walking a fine line on everything that we have to decide on. And so we're thankful for all the messages and texts and calls that you've sent us, support, and please continue to do that. Remember us in your prayers, along with our county, state, and country. May God bless you and your family.
Thank you.